Hi, everyone, and welcome. I'm so glad you're here today. We're about to embark on a truly vital conversation, especially for those of us in our golden years. As we age, we often think about keeping our minds sharp, our hearts healthy, and our bodies active. But how often do we truly focus on the very framework that supports it all? Our bones. Our bones are incredible. They provide structure, protect our organs, anchor our muscles, and even store essential minerals. But here's a startling fact. As we get older, our bone density can naturally decrease, leading to increased risk of fractures and conditions like osteoporosis. Many of us might be diligently consuming calcium-rich foods, and that's fantastic. Calcium is undeniably crucial. But what if I told you there's one specific nutrient that plays an even more pivotal role in ensuring that calcium actually gets to your bones and truly strengthens them? A nutrient that many seniors are actually missing? Today, we're going to uncover this number one nutrient for bone strength. We'll explore why it's so vital, how to know if you're getting enough, and simple, actionable steps to ensure your bones remain strong and resilient for years to come. Stay with us. This information could truly change the way you age. Let's first acknowledge the reality of bone health as we age. It's a natural process that bone remodeling, the continuous breaking down and rebuilding of bone tissue, becomes less efficient. In our younger years, the rebuilding outpaces the breakdown. But as we get older, particularly for women after menopause, the breakdown can start to win. This imbalance can lead to conditions like osteopenia, which is a precursor, and then osteoporosis, a disease that causes bones to become weak and brittle, so brittle that a fall or even mild stresses like bending over or coughing can cause a fracture. And hip fractures, in particular, can have devastating consequences for seniors, often leading to a loss of independence, chronic pain, and a significant decrease in quality of life. The statistics are sobering. But here's the empowering part. Bone loss is not an inevitable sentence. While some decline is natural, severe bone weakening and fractures are largely preventable. We have the power to influence our bone health through lifestyle, diet, and yes, by ensuring we get enough of key nutrients. Many of us focus on calcium, and rightly so. Dairy products, leafy greens, fortified foods, they're all excellent sources. Calcium is the building block. Think of it like the bricks for your bone house. But what if you have all the bricks in the world, but no mortar to hold them together, or no workers to transport them to the right place? That's where our number one nutrient comes in. It's the essential supervisor, the transporter, the enabler that ensures those calcium bricks are properly utilized to build strong, dense bones. Are you ready to discover what it is? Yes, the number one nutrient we're focusing on today for bone strength, especially for seniors, is vitamin D. Now, you might be thinking, vitamin D? I thought that was just for mood or immunity. And you'd be right, it does play crucial roles in those areas. But its primary, undisputed, and most critical function, particularly for bone health, is something called calcium absorption. Imagine your small intestine. It's where most of the nutrients from your food are absorbed into your bloodstream. Without sufficient vitamin D, your body can only absorb about 10 to 15% of the calcium you consume. That's right, a staggering 85 to 90% could just pass through your system without ever reaching your bones. But when you have adequate vitamin D, that absorption rate jumps to a remarkable 30 to 40%. This means more calcium is available in your bloodstream to be delivered to your bones for strengthening and repair. Vitamin D acts like a key, unlocking the doors in your intestine to let calcium in. Without that key, those doors stay shut. It's truly that foundational. But vitamin D doesn't stop there. It also plays a vital role in regulating phosphorus levels in the blood, another mineral essential for bone formation. And it directly influences bone remodeling itself, helping to ensure a healthy balance between bone breakdown and rebuilding. So, while calcium is the building material, vitamin D is the foreman on the construction site, making sure those materials are transported, used efficiently, and that the entire bone building process runs smoothly. Without this foreman, your bone house will be weak and crumble. Now, let's zero in on why vitamin D is even more critical for seniors and why so many of us are at risk of deficiency. Our primary source of vitamin D is sunlight. When our skin is exposed to UVB rays, it synthesizes vitamin D. However, as we age, our skin's ability to perform this conversion dramatically decreases. A 70-year-old produces significantly less vitamin D from the same sun exposure than a 20-year-old. This means relying solely on sun exposure becomes increasingly challenging as we get older, especially if we're not spending much time outdoors. Many seniors spend more time indoors due to mobility issues, health concerns, or simply lifestyle choices. Even when outdoors, we might be more diligent about using sunscreen, which, while crucial for skin cancer prevention, also blocks UVB rays and thus vitamin D synthesis. While some foods naturally contain vitamin D, they are relatively few. Fatty fish like salmon, mackerel, and tuna are excellent sources. Small amounts are found in egg yolks and some fortified foods like milk, cereals, and orange juice. But for many seniors, dietary intake alone is often insufficient to meet their needs. Couple this with potential appetite changes, dietary restrictions, or digestive issues that can sometimes accompany aging, and you have a recipe for low vitamin D levels. Once vitamin D is synthesized in the skin or consumed through diet, it needs to be activated in the liver and then in the kidneys to its active form, calcitriol. As we age, kidney function can naturally decline, which can impair this activation process, further contributing to vitamin D deficiency. So, you can see how multiple factors converge to make seniors particularly vulnerable to vitamin D deficiency. It's not just one thing, it's a perfect storm. And this deficiency directly impacts your bone health, making you more susceptible to fractures and osteoporosis. Understanding these challenges is the first step towards overcoming them. Now, let's talk about recognizing the signs. It's often called the silent epidemic because vitamin D deficiency can be subtle and its symptoms can often be mistaken for other age-related issues. But being aware can help you prompt a conversation with your doctor. Common signs and symptoms can be indicative, but not definitive. Frequent illness/infections. Vitamin D plays a role in immune function, so frequent colds or infections could be a subtle sign. Fatigue and tiredness. Feeling unusually tired, even after a good night's sleep, can be a symptom. Bone and back pain. As we discussed, vitamin D impacts calcium absorption, so chronic aches and pains in your bones or lower back could signal a problem. Muscle weakness and aches. Vitamin D is also important for muscle function. Generalized muscle weakness or unexplained muscle aches could be a sign. Impaired wound healing. Slower healing of cuts or bruises. Depression or mood changes. While not directly bone-related, vitamin D receptors are found in areas of the brain linked to mood. Hair loss. Sometimes, severe deficiency can manifest as hair loss. Now, I want to emphasize that these symptoms can be caused by many different things. The only definitive way to know your vitamin D status is through a blood test. Ask your doctor for a 25-hydroxyvitamin D test. This measures the amount of vitamin D in your blood. The results will typically be given in nanograms per milliliter, in/ml, or nanomoles per liter, mol/L. While optimal levels can vary slightly based on different medical organizations, generally, a level of 30 nanograms per milliliter or 75 mol/L or higher is considered sufficient for bone health and overall health. Levels below 20 nanograms per milliliter are considered deficient, and between 20 to 30 nanograms per milliliter are often considered insufficient. This simple blood test can provide invaluable information and guide you and your healthcare provider on the best course of action. Don't wait for a fracture to find out if you're deficient. Be proactive. All right, you know the importance of vitamin D and how to check your levels. Now, let's get to the actionable part. How do you ensure you're getting enough? There are three main avenues: diet, sunlight, and supplementation. And for most seniors, a combination is often the most effective approach. While food alone often isn't enough, it's a great place to start building your foundation. Fatty fish, salmon, mackerel, tuna, and sardines are excellent sources. Aim for at least 2 servings a week. A 3.5-ounce serving of salmon can provide around 400 to 600 IU of vitamin D. Fortified foods. Many dairy products, milk, yogurt, plant-based milks, almond, soy, oat, cereals, and some orange juices are fortified with vitamin D. Always check the label. Egg yolks. A small amount of vitamin D is present in egg yolks. Mushrooms. UV-exposed some mushrooms, when exposed to UV light, can produce vitamin D too. Look for UV treated on the label. Sunlight exposure is our body's natural way of making vitamin D. However, it comes with caveats, especially for seniors. Timing. Midday sun. Around 10 a.m. to 3 p.m. is when UVB rays are strongest. Skin exposure. You need direct skin exposure, typically arms, legs, and face. Duration, 10 to 30 minutes, several times a week, is often sufficient for lighter skin tones. Darker skin tones require more time. Factors to consider: time of year, geographic location, cloud cover, and sunscreen all impact production. Caution for seniors. Be very mindful of sun exposure to prevent skin damage and cancer. If you're fair-skinned or have a history of skin cancer, discuss sun exposure with your doctor. For many seniors, especially those with limited mobility, relying solely on sun exposure is not practical or safe. For many, the sun is a bonus, but not a reliable primary source due to the reasons we've discussed. Supplementation, often the most reliable for seniors. Host. This is where many seniors will find the most consistent and effective way to ensure adequate vitamin D levels. Dosage. The recommended daily allowance, RDA, for adults over 70 is 800 IU, international units. However, many experts and studies suggest that seniors, particularly those with deficiency, may require higher doses, often between 1,000 to 4,000 IU daily, to reach and maintain optimal levels. Type. Look for vitamin D3, cholecalciferol. This is the same type your body produces from sunlight and is more effective at raising blood levels than vitamin D2. A form. Supplements come in various forms: pills, capsules, liquids. Choose what's easiest for you to take. Talk to your doctor. This is crucial. Always discuss vitamin D supplementation with your healthcare provider. They can assess your individual needs based on your blood test results, health conditions, and other medications you might be taking. They can also recommend the most appropriate dosage for you. When to take it. Vitamin D is fat-soluble, meaning it's best absorbed when taken with a meal containing some fat. While vitamin D is our #1 nutrient for bone strength, it's essential to remember that bone health is multifaceted. It's a team effort. Calcium, still critical. Ensure adequate intake through diet or supplementation as recommended by your doctor. Vitamin K2 works synergistically with vitamin D to direct calcium to the bones and away from arteries. Found in fermented foods and some animal products. Magnesium, involved in bone formation and vitamin D activation. Found in nuts, seeds, leafy greens, whole grains. Weight-bearing exercise. Activities like walking, jogging, dancing, and strength training put stress on bones, stimulating them to become stronger. Aim for 30 minutes most days of the week, if medically. Let's quickly debunk a couple of common myths. Myth number 1, I drink milk, so I'm fine for vitamin D. While milk is often fortified, the amount of vitamin D per serving is typically low, around 100 to 120 IU. Unless you're drinking gallons, it's unlikely to be sufficient on its own, especially for seniors. Myth number 2, more sun is always better for vitamin D. Excessive sun exposure without protection increases your risk of skin cancer. There's a limit to how much vitamin D your body can produce from the sun in a single session. Once that limit is reached, further exposure only increases skin damage, not vitamin D. You have the power to significantly impact your bone health. Don't let the silent threat of vitamin D deficiency weaken your foundation. Here are your actionable steps. 1. Talk to your doctor. Schedule a blood test to check your vitamin D levels. This is the single most important step. 2. Optimize your diet. Include fatty fish, fortified foods, and other nutrient-rich options. 3. Consider supplementation. Under doctor's guidance for most seniors, a high-quality vitamin D3 supplement will be key. 4. Embrace weight-bearing exercise. Get moving. Even gentle walking makes a difference. 5. Holistic lifestyle. Remember calcium, magnesium, vitamin K2, and avoiding harmful habits. Your bones are your lifelong support system. Invest in them. Give them the number one nutrient they desperately need, vitamin D, and watch them thrive. By taking these proactive steps, you're not just preventing fractures. You're investing in your independence, your mobility, and your overall quality of life for years to come. Thank you for joining me today. I truly hope this information empowers you to take charge of your bone health. If you found this video helpful, please like it, share it with someone you care about, and subscribe to our channel for more valuable health insights for seniors. Stay strong, stay healthy, and live vibrantly.